Singapore is extending COVID-19 measures for another month as infections rise. The restrictions will continue until the 21st of November to help ease the strain on the healthcare system. Now, Singapore's COVID task force says that a $640 million support package will also be rolled out as to help firms through this time. Eligible businesses will receive about 25% wage support. Now, qualifying tenants can also receive rental waivers. Plus, there will also be assistance for taxi and private hire car drivers.
It doesn't mean that all the measures will have to remain frozen or static throughout this entire month, because we will continually review the situation in the coming weeks to see if there is any scope for calibrated easing. And in instances where the risks are acceptable, in some of these settings or where there are measures where certain risks are acceptable, we will consider moving first on these measures.
More than 2,000 volunteers from the SG Healthcare Corps are set to be brought in to bolster Singapore's healthcare system. 800 are ready to be deployed. Now, yesterday there were nearly 4,000 new COVID-19 cases and 7 more deaths, bringing the death toll now to 246. For more, we're joined by Cheryl Goh. Cheryl, why are these reinforcements needed?
Well, Dawn, as you rightly mentioned, the number of new cases that we see every day are still in the thousands, and they are not going down. And today, the task force did update that at the moment, 90% of COVID-19 isolation beds in our public and private hospitals are already full. And also, 2/3 of our ICU beds are already occupied. So really, our healthcare system is on the brink of possibly being overwhelmed. What we see are 200 beds in the ICU set aside just for COVID-19 patients, and these are patients who require additional care. And understandably, this would put extra strain on healthcare resources and manpower. Now, Healthcare Minister Ong Ye Kung also did say that Singapore does have the capacity to ramp up another 300 ICU beds. But of course, this would come at a trade-off at the expense of other medical services, and healthcare services would have to take a back seat. Now, to further drive home the point, Minister Ong also did say that the infections among unvaccinated seniors still remain very high. And in fact, 2 in 3 of these patients in ICU or who have died are patients, are unvaccinated seniors, and the risks of them developing complications increases exponentially as they increase in age. So those in their 60s and 70s are really at risk, especially if they are not protected. So the volunteers from the SG Healthcare Corps, they really are critical at this point to come in to really help to spread the load among our healthcare workers. And this is especially crucial because there are plans to give our current healthcare workers the leave, the vacations that they really deserve, especially those who may have come here from other countries. They haven't been home in the past 2 years. So it's really the time that we need to give them so that they can go home and see their families. Let's hear from Health Minister Ong Ye Kung.
We do have to take care of their well-being as well, which is why MOH have also issued a circular to allow and to ask the clusters to start rostering them to go on leave towards the end of this year. And I think it's much needed relief for the healthcare workers. From now to then, as I mentioned briefly in my talking points, is we do need to beef up the manpower so that we can provide relief to them.
Well, besides the volunteers, Mr. Ong also added that they will be tapping on healthcare manpower from the private sector to really help spread the healthcare load. Once again, these are people who may be helping currently in vaccination centers, etc. So these may be brought in to help booster and help to care for the patients who need them. Back to you, Dawn.
It's all hands on deck. Cheryl, thank you very much for that update. Cheryl Goh there live.